Good day, everyone. I am your service, Diljan M. Tare, and our topics for today's vlog is about autopsy and how it is done. So, let's begin. Autopsy means a post-mortem dissection of a dead human body in order to determine the cause, seat, or nature of disease or injury, and includes the retention of tissues customarily removed during the course of autopsy for evidentiary, identification, diagnostic, scientific, or therapeutic purposes. So, let's talk about the procedure of how autopsy is done. First, a visual exam of the entire body is done, including the organs and internal structures. Then, microscopic, chemical, and microbiological exams may be made of the organs, fluids, and tissues. The third step is the all organs removed for examination and weighed, and a section it is preserved for processing into microscopic slides. A final report is made after all lab tests are complete. The autopsy result may last up to 2 to 4 hours. The result of lab tests on samples of body fluids and tissues may take a few weeks to be returned. So, for today's video, the question here is how accurate the results of the autopsies are. So, according to the accuracy of the clinical diagnosis has been the subject of numerous research studies. These studies have consistently shown that in 20 to 40% of autopsied patients, there were important treatable conditions that were detected at autopsy that were not diagnosed clinically. Abstract, despite 75 to 90% precision accuracy in determining the underlying cause of death, precision of determination of the immediate cause of death is approximately 40%. In contrast, two-thirds of immediate causes of death in hospitalized patients are correctly diagnosed by post-mortem computed tomography or CT. In addition, an autopsy, or also known as a post-mortem examination or necropsy, is a medical or surgical examination of a deceased person's body to determine the cause of death, to identify or characterize the extent of any disease states the person may have had, or determine whether a particular medical or surgical procedure was successful.